I'm He Liu from Anzhen Hospital. So first, let's talk about what digital health technology are and what they can do. So to my knowledge from my daily life and the previous published reviews, we know that digital health technology always including software, hardware, and telehealth platforms. And for the software, it's always in forms of health management apps and lots of decision tools, which may be based on knowledge or evidence from guidelines, which could help us to do the clinical decision making. And in the big data era, there are more and more data-driven models or tools which can do risk prediction or differential diagnosis based on the cardiovascular images, and also can help us to do treatment decisions. And the hardware, including sensors and traditional monitors and wearable devices. And sensors like the PPG, ECG, and the traditional monitor, like we know that blood pressure monitor and weight scales, and lots of wearable devices we can see today, like ECG patch and a smart watch and a smart bed. The telehealth platforms can integrate the software and the hardware together in the cardiovascular medicines to deliver the healthcare services to people. And what can digital health technology do in the entire healthcare system? The variable and remote monitor technologies can provide real-time data for disease surveillance and risk factor screening, which could enable the doctors to early detect or diagnose many diseases, even outside clinics and hospitals. And when we integrate the data into the evidence-based clinical decision support systems, it also can support the doctor to timely initiation or optimization of medical therapy or other treatment. For example, the guideline-directed medical treatment in heart failure or hypertension patients. So why digital health technology matters for cardiovascular interventions? So we know that remote patient monitoring is the most important part in digital health technology. And there is a scenario to compare the traditional episodic care versus the remote patient monitoring. This graph shows the progression of atrial fibrillation and the severity of concomitant heart failure over time. It shows us between the visits, for example, the face-to-face visit or telehealth visit, the asymptomatic atrial fibrillation and progressive heart failure, they can develop undetected between this visit, as the patient may appear in sinus rhythm when they go to the doctors during visits, which might mask the underlying atrial fibrillations. So we can see the limitation of traditional episodic care. It might limit the continuous management and limit the timely detection or diagnosis or timely adjustment of any therapies. So how remote patient monitor with variable devices disrupt the traditional interaction between doctors and the patients? So nowadays we can see that people have variable devices with them in their daily lives, and they collect healthy data every day. So when they feel uncomfortable, they can take their data to see their doctors at the first time. And they present to their doctors with objective cardiovascular measurements, which were measured by their variable devices, both under resting and physical exercise conditions. And the doctor can use this data to give them the early detections or diagnosis of any disease conditions, and also earlier initiation of any treatment. When the patient go out of the go out of the hospital or clinics, they also can use their wearable devices to facilitate the continued monitoring of the response to their treatment. So this is a different. And these years, we can see that more and more randomized trials were conducted to prove the effectiveness of digital health technology and interventions. This is a study, SMARTER trial, which was led by the Chinese research team from Fuwai Hospital. It's a cluster randomized design. And in this study, 127 villages and over 4,000 participants who were at high cardiovascular risk were enrolled and randomized assigned to either a village doctor-led mobile health intervention group and a rural primary care group. And we can see that in this study, the mobile health intervention group, all of the participants and the doctors using the telehealth platforms which could deliver the healthcare to their participants. And each participant will given a risk profile, and they were stratified into the high-risk individuals. And for each participant, they will get personal health improvement goals and tailored education videos. For example, when the patient will have hypertension, they will be told which blood pressure level you should be to, and he will send the videos to tell them how to control your blood pressure and when you should go to the doctors to adjust your medications. And everyone will have the wearable devices to monitor their daily health data. And if the data is unusual, they will get timely feedback. And the SMARTER trial used a very smart method, the gamified incentive program, to help them to efficiently improve the participants' adherence. And in this program, the participants complete one self-management task. He will win a golden egg. If not, he will get a bomb. So once they accumulated enough eggs, he will get a reward. And this program works really well. And we can see most of the participants had good adherence on the short video view rate and smart band wearing rate and the STEP target achieving rate. So this intervention group, this model led by the village doctors and supported by mobile health technology, works well in the rural area where the resource is very limited and showed very good feasibility and scalabilities. And most of all, this intervention showed that it can really lead to a significant reduction in population-level cardiovascular risk. So this part will talk about the artificial intelligence, which is nowadays the hottest topic, and how artificial intelligence can advance the cardiovascular interventions. So first, let's talk about the relationship between digital health technology and artificial intelligence. The digital health technology, it can provide real-world data which can power the AI, and the AI can act as an analytical engine which can transform this data into the data-driven tools, models, which can do prediction, diagnosis, and treatment decisions. And this AI can make the digital health technology much smarter, like the brain. So let me show you some examples of the potential value of AI in clinical decision makings. So when we talk about the diagnosis, and the AI has already outperformed humans in interpreting the cardiovascular images. For example, when we want to diagnose arrhythmia from ECG or Holters, And this study published in Nature Medicine showed that the AI model has much higher sensitivity than human technicians. And also, the AI model shows a much lower risk of missed arrhythmia diagnosis. And AI is increasingly being used to guide the personalized treatment. During catheter ablation procedure for persistent atrial fibrillation, this study tailored AF trial, they use an AI-assisted model to detect the region of the spatial temporal dispersion area during the procedure and assist the EP to do their work. And the results show that the AI-assisted group had much higher success rate than the traditional method group. The anatomical ablation is 88% versus 17%. So let me introduce two of our ongoing trials focusing on validation of digital technology and AI technology when they are used in prevention of cardiovascular disease. This trial, Diamond AF trial, led by our team, we want to answer the question that whether the atrial fibrillation patient could discontinue anticoagulation therapy under the monitoring of smartwatch or other variable devices after successful ablation. And this is a multi-center parallel randomized trial with a non-inferiority design for the primary efficacy outcomes and the superiority design for the primary safety outcomes. This study has initiated this year and anticipate to end in 2029. And the control group, patient in the control group, they will continue use the anticoagulation medicine, NOAC post-ablation. And for those in the intervention group, they will discontinue NOAC therapy after the blocking period of ablation procedure. And if the patient were detected having atrial fibrillation recurrence using their smartwatch or other variable devices, they'll be asked to reinitiate the NOAC therapy. And we plan to enroll all the 3,744 post-ablation atrial fibrillation patients within 2 years and with at least a follow-up of 2 years. And another trial, WARM-HF trial, we want to determine whether digital consult assisted by variable devices can optimize guideline-directed medical treatment in heart failure patient complicated with atrial fibrillation. It's also a multi-center open-label parallel randomized trial with a superiority design, and it will initiate next year and end in 2028. And in this study, the patient in the control group, they will get routine care, and the patient in the intervention group, they will get some monitor devices, and we will collect the heart rate variation using smartwatch and collect their heart failure related symptoms using regular questionnaire, and heart rhythm using ECG belt, and blood pressure, body weight using the traditional blood pressure monitoring and weight scales. All the data will timely uploaded to the cloud and analysis using a knowledge-driven algorithm. From the algorithm, the patient will be stratified into low risk, medium risk, and high risk. And the result, this result will help the doctors to determine whether to detect the early signs of heart failure worsening and enable the doctor to timely adjust therapy for heart failure and atrial fibrillations. And in this study, plan to enroll 400 patients and randomize 2 digital consult group and real care group. So in summary, Digital health technology and artificial intelligence, it can give the clinicians evidence or AI-based decision support and help them to do virtual consultation or between doctors or between doctor and the patients. And for the patients, this technology can help them to do self-management and help them to engage in the decision-making with their doctors, and also enable remote interventions, and also improve their adherence to the prescribed medical therapy and other interventions. So thank you.